Good afternoon, everyone, and very warm welcome to all of you present here. I am Shifa Sheikh from Docplexis. As we all know, Docplexis is one of the most leading and trusted leading digital platform dedicated exclusively for doctors, focused on enabling continuous medical education and professional networking. So I'm delighted to welcome you all for today's very interesting session on very important topic and trending topic, that is hantavirus, epidemiology and pandemic potential. As we might be aware, hantavirus infection is a zoonotic disease caused by hantavirus is transmitted through inhalation of aerosolized rodent excreta. Epidemiologically, it's shown as the distribution with syndromes such as hantavirus pulmonary syndrome in Americas and hemorrhagic fever with renal syndrome in Asia and Europe. So for this very interesting webinar, it's my absolute pleasure to welcome once again our esteemed speaker on Docplexis platform for today's session, Dr. Amitav Banerjee. Dr. Amitav Banerjee served as in the Indian Armed Force from 1987 to 2005. He started working as professor and subsequently as the head of Department of Community Medicine at Dr. D.Y. Patil Medical College, Pune. Dr. Banerjee has published over 100 papers in national and international journals and has undertaken several funded research projects. He has also delivered several keynotes addresses at national and international conferences. So, without further delay, I would like to hand over the sessions to Dr. Amitav Banerjee. Over to you, sir.
Thank you, Sifa, and it's always a pleasure to come on Docplexus. So today we will be giving an overview of the recent occurrences of the Hantavirus outbreak, which has brought the focus on this fairly old, I would say. It's not a new virus. It's not a new so-called emerging, but it has come to light. And since the outbreak took place on a ship, the world focus was on it, and there was a lot of speculation, panic, whether it will trigger the next outbreak, whether it is COVID-2 or something like that. So today we'll be going through the evidence and what is the published literature on hantavirus. So just to give an overview, it was first recognized somewhere in the 1950s in the Korean War. Of course, that time the virus was not isolated, but the signs, symptoms, the hemorrhagic during the Korean War, a lot of American troops were also affected. And subsequently, virus was identified. And their virus comes under the order Bunia virilis and family hantavirus. It's a big, it's an umbrella under which there are different strains. Number of strains are there. And old world and new world hantaviruses have been identified with different syndromes. The old world, that is in India, Asia, parts of Africa, Indonesia, Southeast Asia, they cause mostly the hemorrhagic and renal syndrome, kidney failure, hemorrhagic. And the new world in Argentina, Latin America, North America, the pulmonary syndrome, cardiopulmonary syndrome. Basically, the pathogenesis is inside the vessels, blood vessels, endothelium. So therefore, the viral load is inside the vessels. So therefore, the transmission is not easy from person to person. Even as they have been saying that Andes virus is transmitted from person to person, but we will go through the literature. Even for the Andes virus, the person-to-person transmission is not very easy, because even the cardiopulmonary syndrome, the pathology is inside the vessel supplying the lungs and the heart. It is the viral load is not in the bronchial tree or the bronchial epithelium or respiratory tract. So therefore, the viral load from the respiratory coughs, sneezes and secretions are minimal. Of course, it can transmit through saliva. So that may be one aspect, because virus multiplies in the salivary gland. And basically, the infection is from the rat droppings, rat urine, rat saliva, rat excrements. So it is from rats and heavily congested, abandoned buildings, abandoned garages. If you just try to dust it, you will raise the dust, and there may be inhalation. So that is the usual mode of transmission. And even for the Andes virus, they have done large cohort, almost 476 patients. They re-examined the data. Earlier, it was thought to be person to person, because when they do the household survey, one person in the household gets sick, then after some time other person gets sick, after some time the third person gets sick, because it has got a very long incubation period, one week to 8 weeks. So one person in the house may get sick 1 week, other person second, third week, that way. So it was thought that it is spreading from person to person. But when they reanalyzed the data, they found that most of them are exposed to the environment, the rat droppings and other things. In Chile, this study was done in Chile. So most of those re-examined studies shows that even for the Andes strain, the secondary attack rate is less than, out of 476 such cases which they re-examined, only 3 they could probably, it is person to person. So that gives a secondary attack rate of 0.6%. So this, whatever this happened on the cruise MV Hondias, that old man, 70-year-old man, gets sick and he dies on 11th April. They go to a cruise in, they go for some sightseeing in Argentina, some village where they are bird watching, and there are some rat droppings. That is the uh, hypothesis they are working on. And he and his wife gets infected. They come to the ship starts sailing from Argentina on 1st April, and the man dies on 11th April. And then afterwards, they go to the 24th, the body and the with the spouse is uh, Saint Helena. They are dropped at Saint Helena, and after some time, wife also gets sick and trying to go back, and wife also dies on 26th. And then 9 people get sick. Out of the passenger of 149 passengers, out of 149 passenger, 9 or 10 get sick. As on today, 12 are sick, 9 confirmed, 2 probable, 1 borderline. So this is not exactly fitting in the known literature. We will go through the paper, recent paper, where the second, out of 476, only 3 could be confirmed to be due to person. That gives zero point 0.6. So out of 149, 12 people getting sick, that gives a secondary attack rate of almost 6 to 7%, is not fitting in the picture. So we will have to re-examine it. Maybe there is a common source. Maybe more people had gone to that village where they went bird watching. Maybe there may be a rat or rat excreta or contamination in the ship, maybe a common source. So these are the other possibilities. So we'll just rapidly go through some of the papers, some of the here which we have collected from published paper. So this is of course the topic, hantavirus potential. So this would be a scope of the session. The agent factors, as I said, it is a Bunyavirinae. It's a big order under the family hantavirus, and there are number of species. Host and environmental factors. Host factors, usually it is an occupational hazard. Those who are handling the rats, who are handling the say safai wala, sewer workers who come in contact, veterinarians, lab workers also perhaps. And it's not a very uncommon, it may be unrecognized also, because we'll see some papers we will show in which they did some survey among blood donors in Vellore, I think. So the positivity rate, IgM positivity rate, was 5.7% among asymptomatic and healthy blood donors. So that shows the actual epidemiology, it may be more widespread than it is thought. And the case fatality rate is very high. Those who are admitted with symptoms, that is 40%, 30%. But perhaps there may be large number of infection and few people may be landing in hospital. So probably the infection fatality rate may be much less than the case fatality rate. So we don't know exactly. So we'll see that in Vellore in 2005, they did a survey on blood donors, more than 5% blood donors, general population, 4% were found to be positive IgM antibodies. Then they did a IgM antibodies of all fever cases. They found 14.7% of all fever cases were having the hantavirus IgM antibodies. So it's an unrecognized infection. And in USA also, they found 2 to 3% general population are having hantavirus antibodies. So it is a subclinical or infection which we are not. And every year there are about 40 cases reported in USA every year of hantavirus. So this hantavirus on SIP is that way not very unusual if you see into the broader epidemiology and broader context of it. So history we will see, and transmission dynamics. Recent outbreak will just go through once again. Then, as I said, we'll go through the contradictions. Like contradictions that we calculated it is almost 6 to 7% if we take that zero case or index case is that old man 70-year-old who died on 11th April, and subsequently 12 people got sick. So we are assuming that he is the person to person transmission. But as per the literature, the secondary attack rate even for the Andes virus is 0.6%. So that is the contradiction with available literature. Usually, no shipping company may admit that they have got rats on board or they have got some problem, because rats are very common. The boat, the cruise had docked in Argentina, which we presume may be rat infested. If they say the old man got infected in Argentina, the ship was docked there for some time. One odd rat might have entered the ship, we don't know. So these are the possibilities. Then we'll just say that vaccine research has started 2 years before this outbreak. That's a coincidence. 2024, the Moderna with the University of Korea, they have started the vaccine research on hantavirus. And what is the pandemic potential? We'll just see whether it can cause a pandemic, which most likely it may not. So it's an RNA virus, and it is most widely distributed rodent-borne viruses. And as we have already discussed, the hemorrhagic fever with renal syndrome, that is the old world, that is in India, and the hantavirus pulmonary syndrome, which the Andes virus, parts of Asia and America. It hantavirus pulmonary syndrome is also referred to as hantavirus cardiopulmonary. But we have to keep in mind that pulmonary syndrome does not mean the respiratory tract is having large number of virus. It is the blood vessels in the cardiorespiratory pulmonary. It is the pulmonary blood vessels. It is endothelial damage. That's why it causes hemorrhage. And the viremia is inside the blood vessels, so it does not only transmit by exchange of body fluids from person to person, just like HIV. So that's why it doesn't transmit very easily. So this is in 1978, it was first isolated, and it was known as hantavirus by after a Hantan river in Korea, I think. While its first global attention, the same type of syndrome was in 1950s. In the United Nations, troops contracted Korean hemorrhagic fever, which led to the scientific pursuit of the unknown virus. So it's a problem of war in barracks, unsanitary conditions, overcrowding, food and other things. They draw the rats and rodents. And they say even in World War I, similar type of symptoms occurred. America's 1993 outbreak in four corners of USA. Four corners is a place. It's not at four corners of USA. Four corners is a district in USA. Led to the discovery of a distinct strain which was known as hantavirus pulmonary syndrome. This is similar what the Andes virus causes. If you remember, a couple of years back, Gene Hackman and his wife were found dead in the big mansion, and the wife of Gene Hackman also was confirmed to have died of hantavirus. So it can occur where there are old villas, old rats are there, rat droppings are there. So this is the paper which is very important. Hantavirus and emerging public health in India is 2005 paper. So here, if you see abstract I have just given, you can see it at your leisure also. It is in the public open access. So last paragraph, I am reading the lower 5 lines of the paragraph that pyrexia illness, people reporting to Vellore, I think must be CMC Vellore, uh, all were tested for IgM antibodies and 14.7% seropositive for hantavirus infection. Cases of fever, almost 15% are having hantavirus. So it's and then general population survey, 4% of people had hantavirus who are living and working in close proximity with rodents. So molecular and serological evidence of hantavirus in rodents and have also been there. It shows that it is quite a, I mean, infection is there. So therefore, this panic is not really justified that from the ship only everybody will come and infect the people on land. And so reasonable precautions to be taken. But since the hantavirus is there since, they say, almost First World War, the 1950s, and in say 70 years or 100 years, it has not caused a pandemic. So there is no reason why it should cause a pandemic now, because person to person transmission, the secondary attack rate is very less, even for the Andes virus. So yeah, 152 serum samples found 14.7 with febrile illness, they were positive with IgM, and 5.7 healthy blood donors positive. These findings suggest presence of hantavirus infection in the Indian population presenting as symptomatic or asymptomatic infections. Because now a lot of things are coming on the social media that these two Indians are there on the ship and they may come and they may spread and they may be like forest fire. So if you see, scientific evidence is there that it is already there, so it is not, doesn't have a potential to really cause such outbreaks. And here is a very important paper, 2021, because this deals with the Andes virus also, the Chile. Evidence of human to human transmission hantavirus. So they did a, I'll just give some screenshots from the paper, and this is an important paper to understand the Andes virus also. So they did 22 studies, they searched and they compiled evidence, including Cochrane and other things. And this also, with the exception of one, this says out of 22 studies, only 21 studies did not document any person to person transmission, except for one study, which I had already mentioned. This related to the Andes virus in Chile, ANDV. This is Andes virus. So in this study, they found out of 476, initially it appeared that there is person to person transmission, but the confounding factor was all were sharing the rat infested environment, housing poor surroundings. So when they control for that, excluded that, so out of 476, only 3 people would be thought to have be person to person who did not share this common environment infested with rats and rat droppings. So out of 476, only 3, that gives to a rate of 0.6% person to person transmission. That's why I was saying this ship, probably there is a common source in the ship, because there is lot of ration, lot of food. The food, something must have got contaminated with rat droppings, even if there no rats have been found in the ships, you cannot exclude. And the closed ventilation system in the ship. And everybody is there, and the dead body was also there. First there was a death on 11 for 10 days, one body was there till it was disembarked at St. Helena. After that, another German died on ship. We will go through the time sequence. So again, that ship was not allowed to dock in Cape Verde because there was a panic. There is some very infectious disease, it may come on land, whereas more cases are on land than at sea, if you see. So that all the may, and then the closed circuit ventilation in the ship, and people were not allowed to move out of their cabins. Even if it is person to person, they could have come on the deck in the open spaces spread out. So all those things we have to keep in mind, that which may have facilitated that 12 cases getting infected. So this Chile, they did the study. Here is the one cohort conducted in Chile, but with a serious ROB, risk of bias. ROB is risk of bias, means that there is a confounding factor that most of the people are not only sharing a person family, but they are also sharing. So person to person transmission, what was thought earlier, may be due to the common environment. So out of 476 household contacts, only 3.4% develops hantavirus pulmonary syndrome, and the remaining 460 were seronegative. Only 3 of the 16, those who got sick, were claimed to be definite human to human transmission, because co-exposure to rodents was unlikely. So only 3 they could exclude that they did not have a co-exposure rodents. So if you see this study, quite study and in an area where it is endemic and this virus, so the person to person transmission was only 0.6%. Analysis of 476 people with Andy strain, 3 human instances of person to person transmission with certainty. This gives a track rate of 0.6%. So this is not fitting that 12 people got sick. They may have got sick, but the source, it may not be due to person transmission, but a common source on the ship, which should be examined again. Of course, it may not be possible to, even the rats may not be there. As I said, maybe food items, something, some contamination with rodent dropping or may have taken place, or more people must have gone to that place in Argentina and infected simultaneously. So this is something, epidemiological investigation is something like detective work. You have to go back again and again to the scene of the event. Something may not fit in the some of the clues or cues may be misleading. Some again you have to go back. So, but now everything is taken up by media and other things, and then there are different conflicts of interest. No shipping company would like its ship to be declared as unhygienic. Like you may get a cockroach in a restaurant with difficulty. They may say that there is a cockroach in the restaurant. So this ship, a rat on the ship also has got this adverse publicity. So this conclusion, the balance of evidence does not support the claim of human-to-human transmission. This is from that paper, 2021 paper. Well-designed cohort and case control studies that control for co-exposure to rodents are needed to inform public health recommendations. So these are some of the important human-to Asian where disease exists, and Chile did not find evidence of it. Then there was a big hype because the wife of the first patient who died, 70-year-old person who died, she had to be evacuated to her hometown when she fell sick. When the husband was disembarked, the body of the husband was disembarked on at St. Helena. She was being flown back to her home country, that is Netherlands. En route, she fell sick and she had to come back, and she was admitted in, I think, Johannesburg, South Africa. And subsequently, the flight attendant who attended to her on the flight, she got sick. The flight attendant got sick. And there was a big hype in the media that it has transmitted to this aircraft. So, but later, the flight attendant was tested negative for the virus. She was sick for some other reason. So this lot of panic can spread by such a. And after the media, there were a lot of reports that there are instances of very casual encounter. People just passed in a party, said hi and shook hands, and then one person got infected, the other person. But you cannot exclude that all are maybe in the same hotel, same party, they may be exposed to the same rodent infested area. So all those have been well studied. So the person to person transmission is not very common, even for the Andes virus, because the pathophysiology also do not support person to person transmission, because the viremia is inside the blood vessels, not on the open or respiratory passages. So this is the sequence of events of the present cruise. This is a Ushuaia. This is the southernmost part of Argentina, where the couple are alleged to have come to see for bird watching, and this was a rat infested area, they said. So again, one common question comes ki whether they are the only two who came. If it has boat has stopped here for bird watching, there have been other passengers, so that is not being mentioned. They say only these two got. So because incubation period has got a big window, so even if they got exposed simultaneously, they must 10, 12 may got sick at different times. That is one part which we have to consider. And second is whether there is a common source in the ship itself. So this is the sequence of events. 1st April, the ship departs from Argentina. 11th April, Dutch dies on board. 24th April, spouse with body disembarks at St. Helena. And the spouse dies on 26th April. She tries to go back to Netherlands, falls sick, and she is again taken to Johannesburg. And at 24th April, a British band also disembarked, airlifted to Johannesburg, South Africa. Here, they identify the Hantavirus infection. Earlier to that, people were getting sick on the ship and nobody thought it is Hantavirus. So this is the first time. And then there is a lot of panic, as you know, the media. Then 24th April, because before people know it is hantavirus, many people disembarked also, and they went to the different places where they belong, and all are well. Then 26th April, a German dies again on ship, and Cape Verde, it refuses to dock. And then 2nd May, WHO recommends passengers to stay on cabin when it is found hantavirus. So this also doesn't make a lot of scientific sense. Even if you are saying person to person, the same ventilation system, so they should have been in the open, or if they really thought it, they all could have been airlifted and kept in open spaces if they thought, or they should have left the ship, because ship could have been a common source of infection. Oh, these are just one of the possibilities we have to keep in mind. And 10th May, all passengers disembark at Canary Islands, Spain. And there was a lot of protest, because there was a lot of panic and media hype. So the Canary Island people were also objecting that we will all fall sick and the pandemic will spread in the island. All those are ill-founded, actually. So as of present position is this: 9 cases have been confirmed among passengers, and 12 reported people who fell sick. Out 9 confirmed, 2 probable, 1 inconclusive, and tragic casualties, 3 deaths. The couple and the German, 2 of which are confirmed to be caused by the virus. The third one is also doubtful, but this is the position. The vessel has since disembarked. All passengers arrived in Rotterdam. Hantavirus came. So they are to 23 different countries, the people who were there, and they are undergoing 42 days quarantine and monitoring period. So, I mean, it is being on the safer side. Of course, it doesn't transmit if it is they are positive. And secondly, and if they don't have symptoms, they can't transmit. If they have symptoms, the viremia is there at the initial phase, and transmission is through body fluid. So if they can avoid intimate contact with their household, with their spouses, so just like hepatitis B, HIV is spread. So we think we should be quite assured that it will not transmit easily. So anyway, they are being on the safer side, and this is the situation of the boat cruise ship. And here are the other happenings. The vaccine was Korea University Vaccine Innovation Center collaborates with Moderna hantavirus mRNA vaccine. It was started developing in September 2024. Usually, you expect a vaccine, it requires a big investment. So usually, it is taken when the large number of people are affected, and it's a public health problem. So it's a accident. Hantavirus is an accidental infection from rodent. Even if the vaccine has to be given, it may be given to those occupational groups who are exposed to rodents. So we have to keep that in mind. And the Moderna shares went up after this hantavirus cruise ship. You just check Moderna shares sort of, because they declared that mRNA vaccine is almost ready. Vaccine Innovation Center mRNA vaccine is almost ready, and the WHO has put it as one of the potential disease X for the next pandemic. But for all the evidence, this does not have a pandemic potential. It has to spread from person to person. It does not have that potential. Until unless there is some mischief, and we need to be concerned. Again, vaccine is being developed. This is again a paper. Andes virus also DNA vaccine is being developed. So these are certain, we have to keep that in mind, different conflicts of interest. And this is a concerning point, that hantavirus, vials of deadly rat virus, vanished from Australian lab in 2021. How can a deadly virus disappear? It is not only hantavirus which has disappeared. With this, Hendra virus samples have also disappeared, and Lysa virus samples have also disappeared. 3 deadly viruses were disappeared in 2021. Hantavirus is again a very rare disease by fruit bats, and it is affecting basically horses. And Lysa virus, of course, causes the rabies infection. It's a very deadly. So all 3 deadly viruses are missing, and after this SARS-CoV-2 fiasco, because though there is still official denial that it is of natural origin, all the evidence points towards a lab modification too. So we should be very concerned. There should be international treaty to prevent any gain of function research, that is tampering with viruses, naturally occurring viruses and other pathogens to make them more spreadable. And so they say they do it to develop vaccines and other pharmaceuticals, but it's a dangerous thing. So this is just for record, and that is last. Seeing all the evidence, the hantavirus already present in all continents among the rodents. It is highly prevalent zoonosis, different manifestation human host, accidental and sporadic. Person to person spread is negligible. This is the worst situation is 0.6% of the Andes virus. And it cannot kickstart a pandemic until unless it is modified in the lab, and we should be concerned about that. So I think that's all. These are the three important references I have given, because all the other references you will find in the three references. So first is that Chandy S. Abramson, Chandy and Abraham et al. This is a 208 study where they found that 14.7% febrile cases are having the IgM of hantavirus. Second is the Toledo et al. This is the Chile study where they found Andes infection, only 3 could be established as person to person. So this is an important paper. We can go back to it again and again, those who are interested. And third is the Paulson paper. This is about the Andes virus DNA vaccine. And so these are all, I think. So thank you. I think that's all. Can take few questions if anybody has some questions. So I think I have finished, Sifa.
Yes, sir. Thank you so much, sir, for your valuable and deep explanation on such a trending topic of hantavirus. So during your presentation, sir, you almost cover everything, but I would like to ask 2 to 3 questions from our audience. So can I go ahead and can I ask it, sir?
Yeah, please do.
So, sir, the first question is, Dr. X, for your experience, how important is climate change and environmental disruption in influencing hantavirus outbreaks?
That's actually from high school to PhD, everybody attributes everything to climate change. So, I mean, it is there even without climate change. If your proper hygiene sanitation is not there, garbage disposal, and now there are a lot of food and restaurant chains are coming, and their landfills are getting filled up. There is lot of rat nuisance. So these are the more dangerous. Climate change, of course, 1 or 2 degree in 10 years rise. I mean, it's a very vague way everything can be attributed, but if hard evidence, we can of course say कि yes, climate change is there. People are encroaching on the forest. There is more interface of man and animal. So that of course that can we have to each situation, but across the board we cannot blame everything on climate change. If we can maintain a proper waste disposal, proper rodent control, proper storage of grains. If you are aware that in India, lot of crores of rupees of grains are eaten away by rats because of poor storage. So that is a danger already is there. The vulnerability is already there from rodents, where we do not have godowns, adequate number of godowns to store our grains. Most of our grains are destroyed by rodents and rats. So they can bring disease also, like hantavirus. So this can be a wake-up call. If we have a good rodent control, we may save our crop also being eaten away. And there are other diseases like leptospirosis. There are other diseases like plague, which are again associated with rodents. So hantavirus is a indicator that we are vulnerable. And of course, whether climate change, everything can be attributed to climate change, but I wouldn't place it very high for.
Yeah, thank you, sir. And the next question I would like to ask, sir, how we can clinicially differentiate between hantavirus infection from other viral febrile illnesses presenting with respiratory syndrome?
Yeah, that's a very good question. Actually, that should start with history. Therefore, you see, I would address the modern doctors and present medical students. We are directly going to the investigation. So, in a traditional, we used to ask occupational history. We used to ask the history of camping, history of picnics, history of. So, if you have to correlate, you have to keep in mind any exposure to rodents, occupation, then history will give you a high index of suspicion. And fever, initial may be non-specific, fever, body ache, diarrhea, headache, there may be some hemorrhagic, and we have got a number of causes of fever. And so blood test, we should also include the IgM for hantavirus, IgM panel. They say RT-PCR, but RT-PCR is gives a lot of false positive. But RT-PCR is not recommended as a diagnostic test. It may be done, but better is to do IgM for recent infection. IgG will give past infection. So IgM panel can be added to the, and particularly there are some endemic areas, southern India, or certain people coming from poor housing where the rat infestation is there. So we have to keep, that's why we take history of housing, history of occupation, history of any camping exposure to rodents, even rat bite may sometimes. So you have to all this combine.
Thank you, sir. And the last question I would like to ask, sir, how concerned should be medical community or a general practitioner be regarding the potential of hantavirus pandemic in clinical practice?
Pandemic, as I said, is not very common, but if there are lot of rat nuisance, so there can be a large number of cases. Though particularly Andes virus is not present. So even if there is a remote chance of person-to-person transmission, which is there in Andes virus, that too in Argentina, Chile, even there it is not there. But in our continent, we have got the other strains which causes the hemorrhagic and kidney failure. So there won't be any pandemic potential as such, but we are should the plague also is from rodents. So plague had caused pandemic in the past. So it has a pandemic potential only for hygiene sanitation is very bad, and we should actually take this opportunity to impose on the corporation, municipalities, and public health department to improve hygiene sanitation, because this is becoming a big problem with all the land where waste used to be disposed are being developed into housing complexes, and urbanization is spreading towards so there is in very big cities also there are problem of waste disposal, which will attract the rodents and rats. So we have to, I mean, at a general practitioner level, we doctors should lobby that we have to improve our hygiene sanitation. Otherwise, there is no pandemic worry as such. But of course, it can be fatal, and renal failure is also very bad. And but anyway, that's about it.
Thank you so much, sir. You almost answered all the questions in very detailed manner. So, on behalf of entire Docplexis team and our audience, we really thanks Dr. Amitav Banerjee for sharing your valuable insights and deep clinical experience on such an important topic, hantavirus, epidemiology, and pandemic potential. So, your sessions has truly helped bridge the gap between technology and everyday clinical practice. And we also thanks all our participants for joining us today for your active engagement throughout the session. And we hope you found this discussion very informative and clinically relevant. So on behalf of Docplexis, we look forward to welcoming you all to our upcoming educational program. Till then, have a great day ahead, all of you. Thank you so much, sir, for your valuable contribution. We are looking for many more contributions with you.
Thank you. Thank you.